There is a major effort underway to boost the number of nurses in New York. Thanks to $51 million from the Mother Cabrini Foundation, Auburn Hospital has just been awarded $2 million towards that goal. Joining us now, Auburn's Chief Nursing Officer, Melissa Rackmil. Melissa, thanks so much for being with us, and congratulations on the grant.
Yes, thank you so much. We're really excited about the grant. Thank you for having us.
So let's talk specifically, what is the grant for, and is there some limitations on how you use it? What's the plan for this?
So the grant is to enhance the nursing workforce, to help increase the number of nurses that we have in the workforce with the projected nursing workforce shortages. So we developed a budget when we had applied for the grant, and we put a lot of work in that budget to help us achieve Pathway to Excellence designation through American Nurses Credentialing Center, the ANCC, and through American Nurses Association. So that's what we're going to use the funds for.
So is it mostly for like current programs, current nurses, or to recruit new nurses, or a little bit of both?
It's actually a little bit of both. Okay. So it'll help engage our current nurses and empower our current nurses through nursing shared governance. But it's also going to be an attraction for future nurses to come join us at Auburn Community Hospital.
What, I mean, obviously that's great for you and for the entire system there and the staff. What's it end up meaning for patients at Auburn Hospital?
Ultimately, when nurses are happy, patients are happy. That's in the literature everywhere. So by nurses feeling empowered, engaged, the nurse's voice is going to be heard through the shared governance model that we're going to implement, and hopefully along our journey to the pathway to excellence. So for our patients, that means that they're going to receive care from nurses who are empowered. They have a say in the way that they're providing care. It's going to help us implement best practices across the board, and we already are, but it's going to further enhance and elevate nursing practice. So we're going to be providing care to our patients with the best possible patient outcomes and happy staff, so happy patients.
Yeah, absolutely. You were just in New York City for the announcement of the grant. It's a pretty competitive process, I imagine. What's it say about Auburn Hospital that you were selected, and I say you in the collective you there, by the Mother Cabrini Foundation?
It sets us apart, I feel. It makes us recognize that other organizations are seeing what we're doing here. We're a small community hospital in a rural setting, and I think that it speaks volumes that we're doing big things here. We're doing really great things in Auburn.
We talk a lot in the Syracuse area about the growth spurred by Micron and supply chain companies, other manufacturers, a real tremendous amount of growth, and kind of how everybody's reacting and responding to that, to the amount of people that are going to be coming into the area. How does that spill over into your coverage area? Because you're really not that far down the road, and that growth doesn't just happen in Syracuse or just in the suburbs around Syracuse either.
Sure. So we talk about that almost weekly, the growth and how it could impact us here in Auburn. We've been making sure that we have access to care to anybody that needs that, whether it's directly in Auburn, the surrounding communities, the possible growth, in the Syracuse area, and we want to make sure that we have access to care. We've been increasing our service lines, adding new services. We provide care to patients, whether they have the ability to pay or not. And this is all based around the vision of our CEO, Scott Barlucci. And so we just continue to add services based off of the need of the community. And I think that we're going to be ready for that when that growth occurs.
Got time for one last quick question, about 30 seconds or so. What's kind of the plan now? Do you have the grant money? Do we get to start right away with implementing some of those programs, or is there a little bit of time before those are up and running, or what do we do now?
So we've embarked on our journey to Pathway to Excellence. We have received year one grant funds already. And so we're working on that. We're identifying gaps and trying to close those gaps. And we're going to continue to work towards Pathway to Excellence journey, which that's great for the community. It's great for our nursing staff now and great for future nurses.
Well, Melissa, I want you to keep us up to date. Have you back again sometime soon. Auburn Hospital's Chief Nursing Officer, Melissa Rackmil. Again, congratulations to all of you, and thanks for joining us, Melissa.
Thank you so much.